Today we are going to discuss the topic larynx. Yes, the layman term for larynx is your voice box. Before understanding what is larynx and understanding the anatomy of your voice box, the layman term voice box, you should need to understand that what is voice, what is sound, how is the sound going to change. Yes, this is for better understanding of phonation. Phonation is production of sound from your voice box. So when you are changing this sound into something called as in the form of words, you are making it into speech. So a direct sound which is produced directly, a frequency of waves, as you might have studied in your physics in your intermediate, the frequency of change in your waves will be producing sound. The direct sound which is produced from your larynx or the voice box is referred to as voice. You all can appreciate that lower vertebrates, yes, lower vertebrates do not have this unique feature of speech which is unique to your mankind. Why they do not have speech there? Because they do not have proper articulators here. So as we are going through the process of understanding larynx, you will understand what is sound, what is voice, what is the intensity of your voice, and how your pitch changes and how this process of phonation occurs. To understand this physiological part, you need to understand the larynx. So anatomically, larynx extends from your C4 level, from the cervical vertebra C4 up till C6. It is made up of cartilages. What are these cartilages? These cartilages are divided into two types. The cartilages include paired cartilages and unpaired cartilages. Coming to the unpaired cartilages first, the first and foremost important is epiglottis. The second most important is the thyroid cartilage. And the third most important is the cricoid cartilage. So these are the unpaired cartilages which are helping in the formation of anatomy of your voice box. What are they? The epiglottis, the thyroid cartilage, the cricoid cartilage. Out of these three cartilages, epiglottis is the best example for the elastic cartilage, whereas your thyroid and cricoid are examples for your hyaline cartilage. Coming to the paired cartilages, there are three pairs of paired cartilages. What are these three pairs? Arytenoid cartilages, corniculate cartilages, and cuneiform cartilages. Okay, so there are three paired cartilages and there are three unpaired cartilages. The paired cartilages are arytenoid cartilages, that they are 2 in number, the corniculate cartilage and the cuneiform cartilage. Let us just have a gist of individual cartilages here. So what are these individual cartilages and how are they forming the larynx, the structure of the larynx? Coming to the epiglottis first. As I have already referred, epiglottis is an elastic cartilage. The shape of epiglottis is tongue shape. Okay. So on the other side I am representing it. This is how you have your epiglottis. So the epiglottis is tongue shaped and it is an elastic cartilage. It has a lower attached end and an upper free margin. We will later on see in the sagittal sections and the coronal sections very easily. So epiglottis is an elastic cartilage which has a lower attached end and a upper free margin, and it has two lateral margins which are free again. Then you have the thyroid cartilage. Thyroid cartilage has two lamellae. What are these lamellae? They are two shield-like structures. Okay, the thyroid lamina. These two shield-like structures meet in the center to form a prominence which is called as the thyroid angle. So this is the thyroid angle. And what is this thyroid angle? In layman terms, you call it as the Adam's apple. So most of the men have a very prominence of this thyroid cartilage which is called as Adam's apple. Usually you find very conspicuous, very small or very negligible Adam's apple in females. You find a better. Why is this difference in Adam's apple or the thyroid angle? In females, the angle between the two lamellae of the thyroid cartilage is very larger angle. It is more than 120 degrees, whereas in men it is perpendicular. Each lamella is perpendicular to each other, forming a very acute angle. Because of this acute angle, usually the voice, the pitch of the men is lower compared to the women and children. So this is the part of thyroid angle. Coming to the lamellae and the structure of the thyroid cartilage. Yes, so if I am taking a sagittal section of the thyroid cartilage here, this is one lamina on one side. I am showing you the lateral part of your thyroid cartilage. Each lamellae extends behind with a depression with an superior horn. So this is a superior horn. And in a similar way, on the lower surface or the lower border, it extends as an inferior horn. So the thyroid cartilage, each lamina has an inner surface and an outer surface, an upper border and a lower border with the laminal anterior. Both the anterior borders, as I have represented earlier, meet in the center to form the thyroid angle. The superior border extends behind as the superior horn, whereas the inferior border extends behind as the inferior horn. So this is the basic structure of thyroid cartilage, and I have told you that thyroid cartilage is completely made up of hyaline cartilage. Coming to the cricoid cartilage. Cricoid cartilage has the shape of a ring, a signet ring. Very clearly to express it, what is a signet ring? Signet ring is a ring previously used in history by kings, where they used to have a ring in their hand, where their anterior part, yes. So this is the anterior part. The anterior part was very small, whereas the posterior part was larger. So it has two arches. So if you refer the shape of the cricoid, it is referred to as signet ring. It has an anterior arch which is very shorter compared to the posterior arch, and it has an upper border and a lower border and an inner surface and an outer surface. So I am representing you, except for the epiglottis, both the thyroid and the cricoid cartilage, we are representing the lateral views here.
For a complete understanding of the topic, please download our app now from Play Store.